Aisha, you pitched a story of all the things you've got to worry about if you're at a hospital or a medical center. Identity theft is now one of them. What do you got?
Absolutely. I'm chasing a story in Hackensack where a woman was arrested for stealing the identity of patients she worked with at the Hackensack University Medical Center. Police say that 38-year-old Latoya Sapp used her position as a coordinator of medical records to gain access to personal information. We're talking date of birth, we're talking social security numbers. She trafficked that information and she used it in cohorts with a group that was involved in an elaborate credit card scheme. So I chased the story to Wayne, New Jersey, where this woman lives. She was not home. This is a beautiful neighborhood. This woman is a mother of 2 sons. One is in college, one is younger, and now I don't know what's going to happen with him. I did have a chance to speak with a next door neighbor. The neighbor was floored when I told her about the arrest.
She's a wonderful mother. She's a wonderful mother, wonderful neighbor. I am like in so much shock.
One thing I want to make clear is that Latoya Sapp actually worked for Cogent Healthcare Services. That's a company that's under contract with the hospital. I reached out to a rep from the hospital. They still don't have an idea of how many patients were impacted by this one woman's actions.
This is allegedly. She's been charged with this. She's not been convicted. So we want to bring in Joe Giacalone. Joe, you're a former New York City police detective. I hear this story, and with the reputation of the Hackensack Medical Center, tells me this could happen anywhere to anyone.
And not only it happens anywhere, it's happened everywhere from California to New York and in between. And it doesn't really matter about the facility itself. This is where all the information is. You think about it, from the second somebody, who hasn't been to the doctor? Let's put it that way.
Right.
Everybody's medical records are on there. And this was an unintended consequences of putting that information out there on electronic means without, having a plan or, well, we hope this doesn't happen. And one thing I learned in my law enforcement career, hope is not a plan.
Joe, why do people do this? I mean, this is a woman that clearly lived in a nice neighborhood. She had a good job. What is the lure? I mean, how much money is involved here? Well,
like everything else, greed always takes over. I mean, these situations where you can make hundreds of thousands of dollars in a matter of minutes, and think about it. If you do this to 100 people in one day and get a $1,000 credit card, I mean, you do the math. It's very easy. And that's part of the problem, and it's very difficult to identify them unless they make a big blunder.
It's so funny to me because these HIPAA privacy laws have been put in place. Now we go to the doctors every time we have to sign this documentation. I recently switched doctor's offices. I had to go through so much trouble to get access to my own records, get all these people behind the counter. Who knows who is there, and they can all just get access to them immediately.
Is there a solution out there for the average patient just walking into the hospital, giving up all that information?
No, because this is what they wanted. They wanted all, for the safer environment, the safer health care. I mean, this is what you give up when you give up your identity. I mean, this is part of the problem.
It's like the lesson of Obamacare. Don't get sick. Thanks, Joe. Thanks, Aisha.